Hello everyone, I am Dr. Manoj Aggarwal, Senior Consultant in Department of Internal Medicine in Max Hospital Shalimar Bagh and running my own clinic in Sector 24 Rohini with the name of Vihan Healthcare. Today we are going to talk about a very important thing which we are commonly suffering and which we are commonly having, that is hypertension. What exactly is hypertension? Hypertension is increase in blood pressure. And normally in general population we totally ignore this thing till the time we are having complications with the hypertension, then only we go to our doctor and get a consultation for that thing. So we need to take hypertension in a very serious manner because there are many complications associated with hypertension. What exactly is hypertension? Hypertension is increase in the blood pressure. There are two types of pressure which we normally measure. There is a systolic blood pressure and a diastolic blood pressure. Both pressures, increase in the pressures of either systolic blood pressure or the diastolic blood pressure is known as hypertension, or if any of these is increased, it is also known as hypertension. So it doesn't mean we are just having a systolic blood pressure high, we are not having hypertension, or just the diastolic blood pressure high, it doesn't rule out we are having hypertension. So we need to get treatment for both the things. So hypertension can be a person who is having a family history is more prone to get hypertension. So we need to see if a person is having any history of hypertension or heart disease. So we need to get a regular checkup to know whether we are suffering from the hypertension or not. Second reason for the hypertension is our lifestyle. If we are not doing a regular exercise, if our diet is not proper, if we are eating very unhealthy diet, then we are very prone to get hypertension. Also we are having lean, more obese, then also we can get hypertension. Third is the secondary hypertension. Secondary hypertension is when we are having some diseases like renal disease. In renal disease means the kidney disease. So we can also get the hypertension, and there are many other causes of secondary hypertension. So whenever we start having some symptoms of hypertension like lightheadedness, means heaviness in the headache, or we are feeling some giddiness, or we are having more fatigability, it means we might be having hypertension. So we should go to our doctor and should get a blood pressure measured and see whether we are having hypertension or not. So now how to prevent and how to monitor these things? So normally what we can do, we can have a continuous blood pressure monitoring. There is a normal thing which we are going. Sometimes there are people who are having hypertension when they enter into the doctor's chamber. This is known as a white coat hypertension because we get more anxious when we went into a doctor's chamber and our blood pressure rises. So to know whether we are having that thing or not, we can go for a continuous blood pressure monitoring for the 24 hours. In that thing, what we do, we just put a machine on your arm and it takes your blood pressure reading after every 15 minutes, and we can see whether you are having any hypertension or not. If you are having persistently increase in the blood pressure readings, that is more than 140 by 90 millimeters of the mercury, then it means we are having hypertension. Hypertension doesn't mean that if we are having a high blood pressure, we directly need to start with the medicine. So whenever we are diagnosed with hypertension, the first thing which we prefer is change in the lifestyle. What do we do in the change in the lifestyle? Change in the lifestyle is regular exercise. Regular exercise can be in any form. We can go for the walking, running, swimming, cycling, or even we can go to a gym. So that we can increase our body activity and we can manage our blood pressure. The next thing what we can do is change in our fooding habits. We can just reduce our salt intake, we can reduce fatty food intake, we can just reduce our carbs intake, so that we can have a better control of the blood pressure, because it helps in reducing the weight. What exactly? Weight is a major component which is responsible for the hypertension as well as the diabetes, because obese people are having both the disease because of their weight. So reduction of the weight is very important in controlling the hypertension. So definitely change in the lifestyle, to have a constant monitoring of our blood pressure and to get a regular investigations, like we can go for a lipid profile monitoring whether we are having any high cholesterol levels or not. If we are having high cholesterol levels, that can also be responsible for the hypertension. And further, if we are having a persistent high in blood pressure, it can cause complications like it can lead to heart disease, or we are commonly seeing people having paralysis if their blood pressure is shoot up beyond 180 by 120 or sometimes more than that. They can have two types of paralysis attack. They can have a clot in their brain, or they can be bleeding in their brain. So we need to prevent these things by controlling our blood pressure, by changing our lifestyle, by having a healthy dietary plans, and that is very important. So best of luck for all of you to have a better control of your blood pressure, regular monitoring and regular health checkups. Thank you.